Which one am I using? Can everyone hear me? Okay, great. Sorry, I got a little late in the clinic. Welcome to this webinar on the thyroid gland. And of course, before I start this webinar, I would like to give credit to my teachers, because without them, I'm like, of course, I would have not learned this particular way of thinking, nor would I have been guided on the right path to practice. So I would like to give my gratitude and thanks to Dr. Sunirmal Sarkar and Dr. Gajanan Dhanapkar for teaching me this particular way of, or this insight into thyroid diseases. For a deeper understanding into this, I'm here to share with you all my insights into thyroid, but I surely highly recommend that all of you all get a copy of the book written by Dr. Dhanapkar, Conquering Thyroid with Homeopathy. It is a book that you should all have in your clinic. And it is very, very, of course, it is the book, I would say, to use. Yeah. I'm going to go very quickly over the clinical side, the physiology of the thyroid, and some symptoms of the pathology of thyroid, because I expect you all to know this. The only thing is that we have to cover this so that I can go back to it when I'm treating, when I'm showing you cases, or when I'm telling you all about complaints. Okay. Now, we know that the thyroid is a small butterfly shaped gland, and it's at the base of the neck, and its main role is in regulating metabolism and in overall health. One thing which has been very important or significant is that we have a very large section of the population which has got subclinical thyroid. Now, subclinical thyroid is when the patient shows all the symptoms of thyroid, but their reports come normal. Okay, so we have like the either the hunger intolerance, or the weight gain, or the weight loss, or all the complaints that we have of thyroid, but the reports come normal. And this particular class of patients which have got subclinical hypothyroidism, but the reports are normal, is where we can really help the patient. Okay, so homeopathy will play a very good role even in these cases. Of course, we can help in full-blown thyroid cases also, but then this is one part which I think we will be very helpful in. Okay, now we know that it's a crucial component of the endocrine system, and it's what you say, it's located. So when we examine the patient for thyroid, we ask them to swallow, and we see that the gland that goes up and down. Now, that's usually a very good way of differentiating swelling of the neck and thyroid from other swellings of the neck by making them swallow. And then you see the thyroid gland move up and down along with the, what you say, larynx. Okay. Now, here, if you notice, I'm going to show it to you. Here, if you notice, there is the right lobe, a middle lobe, and then you have the isthmus, or the lobe right in between the right and the left. Now, here we have certain remedies that are very, very prominent for even the isthmus, because these are the same remedies which will cause cough with thyroid symptoms. When this thyroid gland starts growing posteriorly, when the middle lobe starts growing posteriorly, then the patient gets thyroid issues with cough. Like we have remedies like bromium and iodine and spongia, and you'll see all these remedies have cough, which is usually dry. There's no productiveness, there's no phlegm that comes out, and it is usually with a larger neck or with a goiter or with goitrous symptoms. Okay, so that's one thing you have to see over here. Now we know that the thyroid produces T3, and then it helps in converting T4 to T3, and it also produces calcitonin, which regulates the calcium levels in blood. So usually patients who have got thyroid cancer will have deranged calcitonin levels, and that's one way that we can detect that cancer. And if this calcitonin is not there, then there is the calcium metabolism is affected. So these patients will usually suffer from osteopenia, they'll suffer from cramps, and they'll also suffer from recurrent kidney stones. Yeah. We know this, but I'm just going to go through it quickly. We have a feedback mechanism where the hypothalamus sends the thyroid releasing hormones to the pituitary gland. The pituitary gland releases thyroid stimulating hormones, which stimulates the thyroid, and then the thyroid helps in making T4 into T3 with, T3 into T4 with one more iodine. Yeah. So this particular thing has a negative feedback mechanism. When there is a lot of T3 in the body, then there is a negative feedback mechanism which goes to the pituitary gland or to the hypothalamus and stops the production of the thyroid hormone for that particular time. Yeah. So here we know that when we talk about hypothyroidism, then in that the TSH is raised. Okay. And the TSH is raised because the body is getting a feedback mechanism that there is not enough thyroid being produced. And then there is a raised TSH. And when there is hyperthyroidism, then usually the TSH is low because it has got a higher negative feedback mechanism, and there'll be raised T3, T4 in the blood. Okay. Now we also know that, as we talked about calcitonin, so we know that the thyroid gland is essential for normal growth and development, especially of the brains of infants and children. It is important for the regulation of the body temperature. It because of the effect on the calcium levels of the blood, it also influences the heart rate and the strength of the heart contraction. It also, because it is directly related to the regulating of all the processes, it will either speed up the digestive process or reduce the digestive process. Okay. So these are mainly places where it goes. And as we spoke about the kidney clearance, because again, that's another process. And again, calcitonin will affect and maybe cause kidney stones if it is raised. And we have bone health. Again, we spoke about the calcium leaving the bones and going to the blood, and that may cause kidney stones. So we'll have weak bones, cramps, as well as defective kidney clearance, either increased urination or decreased urination with the thyroid processes. Okay. So these are some things that so if you can see, the thyroid hormone is going to affect almost all types of processes in the body, right? Including the growth and development. So these are the basic ones that we are going to talk about. In today's topic, we are going to cover everything. Thyroid cancer, not that much. I might just mention remedies, but then we're not really covering the thyroid cancer. We will cover more of hyper, thyroiditis, goiter. Okay, we'll cover this more than the cancers. Okay, I think you'll know all this. So obviously, the thyroid also affects the mental state. We find a lot of patients who can be extremely lazy, but they don't have the drive. And we have patients who are extremely anxious and restless. We have patients who are depressed. All these are actually symptoms of the thyroid. And that's why I keep mentioning that how do we see whether this is the state of the constitution or the state of the thyroid, and how do we treat both the states together? Okay. Please feel free to ask questions. Huh? So these are the symptoms of hypothyroidism. Very simple. There's fatigue, weight gain, chilly, increased sensitivity to cold, constipation, dry skin. The skin becomes thick and dry, and you can't pinch it, because the subcutaneous skin becomes the thickest. Yeah. So that's how I usually detect a patient who, if they have just obesity, plain obesity, or if it is something associated with hypothyroidism. We have puffiness, especially around the face, around the eyes, hoarseness. Again, that is again because of growth of the thyroid posteriorly. Hair loss, hair thinning, very different. The thyroid hair loss is not like the one that we find in testosterone, or it's not like the one we find in progesterone. In cases where the patient has got hypothyroidism and because of that they have hair loss, it's usually a global phenomenon. So basically the entire head will have scanty growth, not the male pattern baldness that you usually see over here, where the patient has got loss of hair from this particular area. Okay, so we'll find a global hair loss that is there. Yeah. Then we have muscle weakness. So you'll find that the patient will have loss of muscle tone, flabby muscles, bat wings, just loose all the way. Aches, pains, tenderness, stiffness. Joint complaints, we have joint stiffness and swelling, depression, memory problems. Okay. The menses can be either scanty and completely absent, or it can be very heavy flow that just doesn't stop. We find both these cases in hypothyroidism. In infants, you find that the patient may have poor growth and they might have delayed developmental milestones, and they might have so they can be mentally and physically retarded also. And usually that's why it is very good to advise a patient to do a thyroid screening test at birth, because it really saves a patient if they are slow. Even your patients who come to you with learning disabilities, if a patient comes to you for low birth weight, with a history of a low birth weight, if a patient comes to you with uh, delayed milestones, you must get their thyroid checked. It is actually mandatory for you to do it, so that you can save a patient a whole life of difficulties and troubles just by catching the disease in the right time. Okay, so this is one thing I usually suggest to most of my patients who come to me with delayed milestones or learning disabilities. Now, Hashimoto's thyroiditis is another very common issue that we have, where they have something which is like hypothyroidism, but it is not hypothyroidism. It is something which is autoimmune. It is something with inflammation of the thyroid. It is something where your antibody levels are very high. You might get normal T3, T4, TSH, but you will find all the symptoms of hypothyroidism, and you'll also find the patient fluctuating between hyper and hyper. So in these cases, you will also see, okay, this patient has, for example, the weight gain of a hypothyroidism, but has palpitations of a hyper. So you'll find symptoms that are mixed. You know the thyroid is at fault, but then you'll find symptoms of all the things together. Okay, and you'll find that today you find that the TSH is 0.001, and after 3 months you'll see that the patient has got normal thyroid levels, and then suddenly after a few months, when you do their test again, they'll say, oh my God, now the TSH is 100. So this is usually seen in both types of thyroiditis. You find it in Graves as well as in Hashimoto's, where the autoimmune state comes up, and that's why you'll find a fluctuating thyroid levels. Yeah. So in hyperthyroidism, I'm sure we see this, all this we know, so I'll go a little fast. Don't mind it. If you want me to go slower, please tell me. How many of y'all are newly passed out, and how many of y'all are experienced homeopaths? Newly passed out, please just give a thumbs up. Okay. Okay. Is it okay if I go fast on this, Naila? Is it okay if I go fast? I'm sure you all covered all this in medicine. Okay, so I'll go fast on this because we have a lot to cover, yeah? So hyperthyroidism, rapid heartbeat, weight loss, nervousness, anxiety, tremors. And the tremors is usually fine tremors. So you put the test where you put the paper on top of the fingers, and then you see the paper trembling. Then increased sweating, changes in the menstrual cycle. They can be either excessive or scanty. You'll find goiter, uh, exophthalmos, and with dryness and loss of vision, muscle weakness and fatigue, and increased bowel movements. Now, increased bowel movements is not always diarrhea. It's just that they go very frequently. So causes are excessive iodine, if they have too much in their diet or in their supplements or medication. So you have to keep an eye on that. There might be, what do you say, thyroid nodules, which are glands which are not at where the thyroid should be, but they are somewhere else in the body. Thyroiditis, where there's an inflammation of the thyroid, or pituitary issues, or Graves' disease, which is one of the most common. The most common is Graves, okay? And what are the complications? Thyroid storm, heart issues because of atrial fibrillation, osteoporosis. I discussed calcitonin with you. Eye problems, because if the exophthalmos becomes too much, then it will lead to eye dryness, and then maybe corneal ulcerations and things like that may follow. And pretibial myxedema, okay, which is a part of Graves' disease. Okay, so this is pretibial myxedema. Okay, where there is this complication where there is, it's just subcutaneous, and there is this doughy swelling which is there. Now, the remedy which I found for this is Kali Bike and Kali Iode. These are both remedies which are basically remedies for the thyroid gland, but then they cover this particular state of pretibial myxedema. So Herring writes for Kali Bike, there's a doughy swelling in the right shin, heat and itching of the skin, burning, itching of papular eruptions, along with sore throat on swallowing. So this is what Herring writes. You'll not find this in the other books, so I'm just giving the reference. Okay, this I'm sure you'll all know it, but then I'm just again sharing it. Pre-T3, T4 and TSH levels. If the TSH is low, it's hyper. If the TSH is low, but then free T3 is high, then it is hyperthyroidism or T3 toxicosis. If it is normal free T3, T4, but low TSH, then it is subclinical hyperthyroidism. If it is normal, that's euthyroid, that's healthy. Then if the T3, T4 is normal or low, and the TSH is also normal or low, this is non-thyroid illness, okay? And if it is low or normal, T4, then it is mild hypothyroidism. And if it is low or normal, T3, then and with raised TSH levels, then this is hypothyroidism. Now, in this particular thing, I would suggest even what I usually do is I do a lipid profile test. And if there is weight gain with increased cholesterol and triglycerides, but the patient is normal in their thyroid tests, usually this is a case of a subclinical hypothyroid case, because that's where it will first show. Okay, it's a good indicator that this patient is going into hypothyroidism. I usually do anti-TPO tests and anti-thyroglobulin tests in any patient that comes to me for thyroid-like complaints, because I want to know it before they start treatment, and then it is easier to understand the prognosis of the case, and we will know that the patient will have both symptoms from both sides. We will not get very happy when their T3, T4, TSH comes to normal, because we know that the issue is much deeper than that. So I usually do these marker tests. Now, again, I'm telling you that Dr. Dhanapkar has taught us thyroid, and he has done I'm very grateful to him, and he's done a great service to mankind by teaching us how to address thyroid cases. And Dr. Dhanapkar has his own case history format, which he has shared with us very kindly. And I do use that. Now, what I'm teaching is a little apart from that. That is very, very important. But then this is also, so let me share my side of this. Yeah. First, what I do is when the patient comes to me, I will first see the body structure of the patient. Is this patient fat or thin? Okay. Are the legs very large, or the upper body very thin, or the legs very thin and the upper body very, very big? Or how does the face look? Is it scrawny, daunted, or is it puffy? You can see that there's puffed up everywhere, or you can see that anxious look with sweating. Okay. Or what about the stomach? Is the weight gain more in the upper body, upper part of the stomach, or the lower part of the stomach? Or is the breast dwindling, thin, lost, or do they have very large breasts? Then you look at the skin, and I'm going to share with you everything. I'll share with you the indications of all this, but I want you to see what I see. Okay, this is what I look at when we see. First, you look at what the patient looks like. That is the first thing you try to absorb. Okay. Now you see whether the skin is dry, whether the skin is very dry and thick. You can't pinch it. Whether the skin is clammy. Okay. Whether the patient is very hot to touch or very cold to touch. Okay. As I told you, you can't pinch the skin of a person who has got subclinical hypothyroid. Okay, you cannot pinch it. It will come. It's like pig skin. When you try to pinch a pig, can you imagine? You can't pinch it because there's so much subcutaneous fat that you can't pinch it. Okay, that is the way you'll find a patient who has got hypothyroidism. Okay, so usually if a patient comes to me with amenorrhea, okay, and I'm treating the case and I'm trying to think, okay, what can be the cause pathologically? Does the patient have amenorrhea because of high testosterone levels, or is the progesterone very high, or is the thyroid playing up in this case, or is it because the patient has got a pituitary issue? So I'm trying to find it out. And in amenorrhea cases, it's very difficult because there's no symptom. They just say, we've not got a menses. What symptom is that, So then to look for these kind of cases, then at that time, I pinch the skin to see whether the patient has got hypothyroid. And if the patient has amenorrhea, but the sonography shows no PCOD, then usually I will think of a case of thyroid. If the uterus is normal, if the uterus is shrunken or this thing, that's a totally different thing. But then if the uterus and ovaries are fine, and yet the patient is not having regular menses, then I will think of the thyroid. Now I look at the hair for thinning, hair fall, male pattern baldness, global hair loss. What quality of hair does the patient have? Is it very dry and frizzy, or is the patient having a good quality of hair, but then it's not, it's falling? So then we look for other causes there. But those are all issues with thyroid. Huh? Then eyes, are they protruding? Can we see exophthalmos? Now, exophthalmos you will usually see from the side vision. Okay, you cannot see it if the patient is sitting right in front unless the eyelids are very retracted, because it's a very, very, you know, obvious case of exophthalmos. Otherwise, you can see it from the side. Then I look at the neck. Is it a long neck? Is it a short neck? Is there multiple, is there fat that is there on the neck? Or can we see these rings? Or can we see the goiter? Okay. And then we look at the swelling. In the swelling, I will first look at it from a distance. I will see whether there is a swelling with a long neck or a fat neck. Then I will look at the swelling and I'll see, can I see any venous engorgement? You know, the bluish veins that can come across. Or can I see the pulsations? It's amazing. I mean, I've seen this. It is for me to see it to believe it. But then you can actually see the heartbeat. Literally, you can see the pulsations on the swelling, the thyroid swelling. Or it's lumpy. It feels like dough. Okay, so you start feeling it and see how does the patient get tickled? Does the patient get pain? Does the patient say, no, it's not paining at all? Sometimes the thyroid is very warm to touch. Sometimes it's shrunken. You try to look for it, but you can't feel it. Okay. Now, in these cases where there is a goiter or there is a swelling, usually you take a simple measuring tape and measure the thyroid swelling every time. And I keep this as a measurement, which we will record so that we can see whether the patient is getting better or worse. Okay. Now here also you have to see whether it's the right lobe of the thyroid, left lobe of the thyroid, or is it the isthmus, like I mentioned to you with the cough and the hoarseness. So then accordingly, the symptoms will change, and according to that, we get new remedies. Okay. So first is the examination of the patient from what the patient looks when the patient enters your clinic. Okay. Now, in the chief complaints of the case, usually here we will come to know what exactly is the most disturbing fact which is disturbing the regular life of the patient, or what is troubling the patient. And this helps us get an entry point into the case. And usually that is the symptom which the patient will describe very well. So we'll get a detailed PQRS, which will help us enter the case, and we will get a more how can I say, accurate prescription if we take this chief complaint very seriously. Now, the chief complaint might be something like weight gain or weight loss. It might also be a migraine. It might be anything. But then when you start asking for those symptoms, one is that you're gaining the confidence of the patient, okay, because the patient and you connect at that level. You're not saying, okay, thyroid, okay, come on, I'll give you medicine. No, you're listening to the patient and trying to understand the patient in detail. And that really helps in connecting with the patient, which will give you a better follow-up. The patient will stay with you for longer because the patient will feel understood at that time. It's very important to take the chief complaint in real detail. Now, the second thing I take very, like I give a lot of importance to is, I ask them, how did you find out you had thyroid and when was it detected? So I get a time, okay, from when it began. So I'll look for triggers in that time or that area when they started getting issues. And I will also get to know the uncompensated thyroid state of theirs. So an uncompensated state is when these patients come to you with thyroid, if they've already started taking Thyronorm or Eltroxin, or if they've already started taking supportive treatment for their thyroid, at that time you will not, they'll say, oh, we have thyroid, we're taking this much medicine and we're fine with it. So you will come with a patient who will be almost asymptomatic. And then it's very difficult to get into the case because you're not getting a whole case. So here in this particular time, when the patient was detected with thyroid, and if you ask for those cases, those symptoms in detail, you get the uncompensated state of the thyroid. So if the patient says, I went to the doctor because suddenly I started swelling up and I started bloating. This is usually seen in thyroidinum. Thyroidinum has a lot of puffiness. Okay. And if they say, I got it in my 10th standard, or I got it when I when I had my baby. So basically at that time, then you know, okay, 10th standard, 15 years, usually puberty, then you know this was a thing where the thyroid came in when the patient had puberty. So then according to that, you get a lot of symptoms and you know, okay, this patient will need thyroidinum because it was ailments from puberty and the patient had puffiness as the first symptom. So it's easy to enter the case. Okay. So look for this changes of life and see if they tell you, I got it in this year, on this time, in my 10th standard, in my 12th standard. In your head, you have to think what was going on at that time. Was the patient going through pregnancy? Was the patient going through menopause? Sometimes they'll say it came after 5 years ago. But 5 years ago, what was happening? Was the patient going through menopause? Was the person going through depression? Did the child leave them and start living separately? You're going to be looking at every possible thing that happened 5 years ago. Okay. So mental and emotional causes, you're going to look at history of loss of fluid, suppression, all the history of causation you will take over here in detail. Okay. Stop me if I'm going too fast or too slow, okay? So you'll know that what you said, the thyroid shows its symptoms in almost everything. Every part of the physical generals and the mentals can be covered by thyroid. Now, the question I was asking is that if you all know that there is a different constitution of thyroid and a person has his own constitution, then how are we going to differentiate the two constitutions? Does anyone have an answer to this? We know that their perspiration will be like this or like that. We know that their sleep will be either too much or no sleep at all. We know that they can be chilly or hot. So how do we decide whether to give a medicine which is for thyroid or whether to give a constitutional medicine, or are we prescribing on common symptoms in a case of hypothyroid or hypothyroid? Can anyone give me an answer? Okay, there's no right and no wrong, huh? Everyone, see, even I'm still learning, and maybe tomorrow, maybe 10 years down the line, I might come back and tell, hey, I was wrong. Y'all are right. Just give me input. I want to know what y'all do and how y'all practice, or what y'all see, or how y'all think when y'all are practicing. Okay, so y'all feel free to. Okay. So then I'm going to come back to this afterwards. We'll be doing some cases, and that time I will come back and we will go through this again. Okay. Now, materia medica. Okay. Now in Materia Medica, the reason I'm going through this is these are typical Materia Medica only for thyroid. Now, please understand, these are symptoms of the thyroid, which I've taken from here, there, and the other. But one has to prescribe after seeing the whole case. And one has to prescribe on a larger level. Okay, it has to be more deep. The reason I share these with you is because these are lesser known remedies and we don't think about them, but they are very much very effective in cases of thyroid. Okay. Now, Elanthus. Elanthus is a remedy which actually we can give for thyroiditis. Okay. So if you can see, there is inflammation, edematous, dusky red, mud swelling of the throat, internal as well as external, means the throat outside also swells, inside also swells. Okay. This dry, rough, scraping, choking feeling. The neck feels tender and swollen. Okay. The teeth are covered with sore. Pain on swallowing extending to ear. And retarded menses. So this is not a throat remedy. It is a remedy for thyroid or goiter. Okay. And usually this is a remedy we give for thyroiditis. Okay. So acute thyroiditis, one of a very good remedy is Elanthus. But it should come like this. And when you see that the patient is detected with thyroiditis, ask, how are your menses? They'll say it didn't come. Then you know, okay, fine. This is the right remedy for them. Now, ammonium carb. Remember we discussed constitution and I said thick neck, thin neck, short neck. Now we know ammonium carb is obese. And how is the obesity? The chest is flat, big hips, big thighs, lower body is more enlarged. We know ammonium carb as on the emotional level also. We know that they have hatred for one person. We know that they have anger and they have anxieties and they have allergic tendencies, which is also very thyroid-like. Thyroid also has a lot of allergic tendencies. They have a lot of sneezing on the waking up, sneezing in the morning when they get out of bed, when they wash their face. So we know all this. But here, for you to remember, this patient is going to be with goiter, with swelling of the cervical glands. They'll be itching on the outer part of the neck. They'll be scratching like this. Okay? And they have the stiffness, rigidity of the fingers. So these are all symptoms of thyroid, but you give it to a patient who also covers the constitution of ammonium carb. So you should know that, okay, ammonium carb covers goiter too. So when you give the patient a constitutional remedy of ammonium carb and you say, oh, thyroid got better, that is possible. Maybe you gave it without knowing that ammonium carb also covers goiter. But a good way to do it is knowing the whole and then arriving to a better prescription where the remedy also covers that particular sphere of action. Okay. Amyl nitrate. So amyl nitrate, we usually know it for heart attacks. We know it is a remedy which works like sorbitrate. We know it for angina. Okay. But it is a very, very good remedy for thyroid, hypothyroidism. It works beautifully. Oh, here also for hypothyroidism. Okay. It works beautifully. Okay, I've not written it here, but amyl nitrate has a very, very important symptom where there is goiter after grief. It is mentioned in Fatak. See. Okay, so it's actually there in Fatak. You can see it's written exophthalmic goiter from grief. Okay, so one of the main symptoms of amyl nitrate in goiter is that it can be, so you don't think just of natriumure, you think of amyl nitrate also. Okay, but when will you give natriumure and when will you give amyl nitrate will depend on what all you know about amyl nitrate and what all you know about natriumure. Okay. Vascular goiter in apis. So when we say vascular goiter, it means that swelling which you have examined in the neck, it will have a pulsation to it. Okay, you'll feel it. When you feel it, you'll see it's beating against your fingers. Aquamarina. Goiter, which is worse in the seaside. Usually most of these remedies, so like if you had natriumure, they'd be better in the seaside, right? But goiter worse in the seaside is aquamarina. Goiter better in the seaside can also be bromium. So a lot of these goiter remedies or thyroid remedies are sensitive to the sea. So they'll either be better or worse over there. Okay. One thing about aquamarina patients, I've learned it beautifully. It was a very well taught to me, but aquamarina is seawater. So it is something which has almost all the salts. It has your phosphorus, iodine, oxygen, nitrogen. It has the salts, it has iodine. So it has a lot of these different salts which are there already in the water. And that's why it is a very deep acting remedy. It also has a bit of natriumure in it. It also has a bit of phosphorus in it. And if you learn the remedy well, it is a very good remedy. But for us to remember it, the most important thing you must know is that here the patient is worse in the seaside and the patient will have lymphadenitis. Okay, they will have mesenteric lymph nodes will be enlarged along with goiter. Arrhenia exebola. Okay, Arrhenia exebola will usually have the neurological issues that thyroid can get. So there'll be trembling of hands, sweating, palpitation, cramps, okay, tetany. All these things you will notice in the patient with chilliness, and it'll be a fever remedy, okay? So they will have chills, fever, throat infection, but it'll be thyroiditis, okay? Aurum, I think you'll know very well, but Aurum, I have used these remedies in thyroid cases and they really work very effectively when the remedy is right. Okay, so even if you get an Aurum case with thyroid, Aurum itself, the constitution itself will improve the patient. Okay, but then they will have heart complaints with thyroid and the same mentals of Aurum. Okay, in Aurum iode, you'll find heart complaints, thyroid complaints, as well as exophthalmia. And the swelling is more on the right side. Aurum mur is a very, again, it is a very syphilitic remedy, and it has rheumatism, it has female complaints, neurological complaints, heart complaints, and bone complaints also. You'll find in Aurum mur that the person will have heart diseases with rheumatic affections, and they will have edema. They'll have rheumatism with depression, again, the same mental state of Aurum. They'll have exophthalmia and enlargement of heart. Now, in my cases, which I've used Aurum mur in, usually these females have got a lot of fibroids and a lot of female complaints along with joint complaints, and they're very depressed people, but they're very responsible also. You'll see them come in with a lot of dignity, okay? They'll have heart complaints. And thyroid is, yeah. So Aurum mur nat, I've written over here, the gland will be stony hard. Okay. Aurum mur nat is usually, we think of it in fibroids, right? We think of heart complaints, we think of, and what is missing is the natrum component of it, one. So you will not find the natrum state coming out in the Aurum mur. Aurum mur is also more neurological than Aurum mur nat. There'll be more symptoms of nervous symptoms compared to Aurum mur natronicum. Okay. And the stony hardness is more in Aurum mur natronicum. Okay. Badiega is again a sea remedy. We know it's a sponge. We know that it is very similar to spongia, but then of course it's a freshwater sponge. So they have palpitations with goiter. Now Badiega is also a respiratory remedy. So there's a lot of cough involved. And what I find very peculiar about Badiega, which actually was something that got me to that remedy and made me learn it in great detail, is that it is the one remedy which is written in the relationship of Merck Sol. Okay, so Merck Sol, can you see over here? Badiega. It is a remedy which is complementary to Merck. In fact, the only remedy complementary to Merck. That is how syphilitic this remedy is. Okay. And it is very, very good in destructive cases where there is more syphilitic states in the patient compared to the regular ones. Okay. So they will have, in fact, I would compare it to Aurum if I had to, because they would have palpitations, they would have goiter, they would have hardness. We know that the Badiega has got stony hardness of the glands. Okay. So I will look for those symptoms when if Badiega is indicated. Okay. Baryta iode. Again, you see the Baryta, you will see a Baryta state, and you will see the iodine state, and you will see a hard goiter, and you'll see a sluggish patient. Okay. So that is Baryta iode. So if I have to give Baryta iode, it'll be, the goiter will be hard and the patient will be slow. Okay. Baryta carb is for delayed milestones with goiter. Belladonna is a very rarely used remedy, but then I have seen it, and I've seen Dr. Sarkar use it a lot. So I think if given statistically, I've seen Dr. Sarkar use Belladonna a lot for thyroid cases, and that's why I'm going to bring it to attention for y'all, because the patient has exophthalmic goiter, they have sleeplessness, they have thyroid, which is either during pregnancy or puberty. Now, these patients, you know, Belladonna is obese. They are flushed easily, they have palpitations, they're chilly patients, they have anxiety. Now, these are all symptoms that you find in thyroid. But we don't think of it when the patient comes and sits in front of us, because we think of belladonna as an acute prescription. But belladonna is an excellent remedy for thyroid. Okay. I suggest you'll use it as much as you can. If you'll see belladonna, the state of belladonna, first give belladonna before you decide any other prescription. We discussed bromium. Now, bromium, the most important thing for you all to remember is the goiter will be hard, okay, stony, hard. And if iodine fails, then you think of bromium. So it has the same kind of cough. It has the same kind of hardness. It has the same kind of infiltration that you find in iodine. Okay. And here we find that the menses will be either suppressed, okay, in serous breast, means in breast cancer, if the menses are suppressed. And same way, the thyroid also, you'll have suppressed menses, okay, with the thyroid. Dysmenorrhea, depression before menses, okay. Also here, they've written menses too early, too profuse with membranous shreds. So these are what we have to look for in the cases of thyroid which need bromium. Cactus. Okay, just wait. Okay. So cactus is again, cactus means I have used cactus in a thyroid case, and I will be sharing that case with you. So the one thing about cactus patients is, again, they have that kind of a palpitation and anxiety and restlessness that you find in cactus. And you have dropsy, you have puffiness, which we saw in thyroidinum, but you'll also see it in cactus. And that's that sensation of that iron band that is around the chest is very, very peculiar of cactus. Okay, and in fact, I think that was what led me to the case. There were other things, but then, and the mentals are very similar to your calcarea ars, or even belladonna has a similar this thing. But then, yeah, but here it is fear of death of heart disease, okay? And they're screaming with pain. They have intolerance to pain, wishing to be alone, not speaking to anyone, a lot of slowness, okay? And agitation at the heart, and feeling of oppression, impulse to do strange things, anxiety on waking, irritability, worse on consolation, sadness during menses. Now, I want to share let me see if I have it here. Yeah. So in this, I'm going to share a case or two today, and then I'll share another case tomorrow. Spongia and bromium. Yes, 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 yes. Yes, please go for that. If they're dark haired and they're dark skinned, or they're blonde, it makes a big difference. You'll be amazed. Badiega also the same thing. Blue eyed, blonde, blonde people are more Badiega. But yes, I do look at that. Okay, and I give a lot of importance to that. Please listen to Boric. It's very true. Okay, so here we're doing a case of, let me see if I can increase this. Okay, so here we're doing a case of this lady. Now she was bedridden, and they were the family was very worried because she had an MRI. She could not move. Her hands and legs were all this thing. She could not walk even up to the toilet and back. Okay, completely bedridden. And they had done an MRI for the spine. They had said there's some issue with the spine, and there's a lot of things. And this person is a very poor person. They live in this tin roofed small place where they're open to the entire environment. If it's cold, it's very cold for them. It's hot, it's very hot. They get fungus in the monsoons. It's a very small shanty place, okay? And we went there to take the history of this patient. Now, of course, they are not very educated, so they gave us very little history. But here is what we had. Okay, so she had breathlessness, she was on aspirin, she had thyroid, she had hypertension, she had diabetes. Okay, this is how she looked. Okay, can you see a little puffiness on the face, swelling? Okay, and she was totally, and you can see the muscle wasting. She had not used her hands and legs for a long time. This is her MRI report. A lot of degenerative changes, scoliosis, and anyways, lots of things. So this is the case. Now we have given this verbatim. Verbatim means the way the patient said it is how we have written it. So if you find it a little erratic, it's fine. But then just let's go through it so that you see it in my perspective and you see it from my point of view, okay? So this patient started with thyroid, and the husband had expired 3 years ago. He had this prolapse of rectum, and he was there. There was a lot of trouble. They had to take care of him. He had blood pressure. He had sugar, and then he expired. And she cried. She cried and she cried, and her face started swelling. After that, she started developing palpitations and vertigo. Then the doctor tested her, and she was detected with thyroid. And then she was put on medication, only 25 mcg. But after that, all the issues began coming. She started trembling. Then they tested her again. They saw that her sugar levels were very low. She can't tolerate hunger. She has severe palpitations, burning in the soles. There's a lot of heat in the soles. She's around 55 years old, and she had menopause 13 years ago. That is 10 years before the husband expired, huh? And 10 years before she got thyroid. And since 3, 4 months, she's not been able to walk. There's swelling on the face, constant. She's bedridden. She can't get up. There are blisters in her scalp. Left side is burning and painful. And the eyebrows to the back of the ear. She has this burning and pain and blisters. Okay, and then they form these scabs, and then they dry up, and then they peel off. And then there's a lot of burning and itching and too much pain. So this was one of the things she had. She's shouting and crying in pain sometimes. Okay, the pain is not deep, it's very superficial. Then she has heart issues, palpitation, loses breath from the palpitations. Palpitations, doctor gave medicine, I have them, then I'm better. I feel I'll die. I can't breathe and I become so restless. I feel I'll die. And she's been on aspirin for many years. History of asthma. She can't take the smell of the ether, the perfume, if someone is frying something, or egg, or chemical dye for dyeing the hair. She can't take the smell of all that. She can't tolerate climate change, dust, crackers. Everything causes asthma. Okay. And she becomes breathless. Paint smell also, she gets breathless. She has swelling in the legs, can't use the Indian toilet. Okay. And she has to sit on the Western type of toilet. Only then she can pass stool. Okay, but that also is difficult. Someone has to take her there, get her back. She's thirsty, but she can't drink too much water. Okay, she has medicine for acidity, bloating in the abdomen, gases, flatus, burping both ways, entire abdomen bloats. She's very, very hungry, but I can't go much. And every time I eat, I have to go for stool. But she trembles if she doesn't get food. She loves meat, loves salt, loves sweets. Okay. Stool comes regularly. Urine is okay. Sweat is slightly offensive and it has a deposit. Sleep is disturbed, interrupted. Has to take a sleeping tablet. And if she snores, then she suddenly shouts in her sleep. She feels as if someone is, what do you say, throttling her. Okay. And if someone is sitting on the chest, but she sleeps with sleeping pills, otherwise she does not get sleep. Mouth dries up in sleep. She gets scared when she's alone, scared of getting an electric shock. She gets scared if there's something cooking and she's scared if the cylinder will burst. She gets scared if someone suddenly starts screaming. She gets scared, she gets palpitations, and she feels nothing should happen. She gets very, very scared. And she feels terrible about how she is. Why am I falling so ill? I have so many medicines. I'm still not getting better. Because she's always worried about that. Why am I not getting better? She thinks maybe the children are not telling her what is her sickness or her illness. She can't even walk, even a little bit. She feels someone should sit with her all the time. She gets very angry and irritable if her children don't return on time. And she feels worse that she can't get up and work and can't do things on herself. She's lying in one place all the time and she always needs support. If only I could just walk and sit in the sun and talk, I'll be good. I'll get better. So this is where she was. Chilly patient. This is her past history. Her family history is also quite strong. Oh, she's hot, but she can't tolerate cold, huh? And she's trembling of the body, shivering. And because of that, she doesn't walk. When the husband was there alive, everything was good. After he passed away, it affected her a lot. And this is the remedy I gave her. Now, amyl nitrate, as I showed you, what Phatak says is goiter from grief. Why I'm showing you this is because these are remedies that usually we don't get if we only think of constitutional remedies or we think of repertorizing the whole case. Okay. But they were actually the remedy indicated. So I'll show it to you from Murphy. So they have angina. They have amyl nitrate, is a very good remedy for angina, anxiety, blushing, dyspnea, okay, goiter, exophthalmos, flushing, heart disorders, heart attack, hysteria, menopausal disorders, palpitations, okay. It's a remedy which we know now that it has a remedy. It is meant for goiter from grief. I've showed that to you. And the person has rigid muscles of limbs. Okay. They have anxiety that something bad will happen, must have fresh air. Anxiety cannot sit still. Okay. Melancholy, mental confusion. Okay. Increased sense of stupefaction, unconscious, inability to swallow. Okay. The the face, as I showed you, there was puffiness on the face, which is also in amyl nitrate. Okay. Menopausal headaches and flushes. Kidneys have increased quantity of urine with sugar in it. Okay. Lungs feel constricted in throat, extended to chest with dyspnea and asthmatic feeling in larynx and trachea. Asthma hastens and deepens the breathing. Suffocation and cough in paroxysms. So in this case, the most important thing which I went for, which I confirmed, was the grief from the husband passing away, because there was an instant thyroid that was found. And as I told you, that is the most important thing which led me to this. And it is a very good remedy for menopausal patients. It is a very good remedy for patients who are diabetic, who have heart complaints, and who already have got grief. Okay. So this remedy was more indicated than Natrimure. And I don't know, I don't know whether this will show up in repertory. If any of you all are very good at repertory, please check and see if the same remedy will come. I'm sharing this case with you not because the patient had thyroid of 25 mcg and just little basic thyroid, but I'm sharing this case because the patient improved a lot. She started moving, she started walking. What is the cause of bedriddenness in this case? Only thyroid problems can't cause this. Very true. So when you look at this, the patient had all her complaints began 3 years ago. Okay. So when you're looking at a case, you're always looking for the first thing that caused it. This is a snowballing effect that has happened. As I showed you, she had an MRI, she had issues that were there in the MRI, and we did treat her for all that later. Okay. So there were issues that were there that we had to treat later. But the first thing that changed the patient completely, okay, was this particular thing that the patient had got the complaints since the time the thyroid came, since the husband died. Okay. Now, uh, just 1 minute. So anyways, here the patient had got all the complaints started from there, and then she started deteriorating, and then she already had what do you say, got diabetes, but then she started getting hypertension, then she got all the other complaints which started coming from there. It was a snowballing effect that started from there. So for me, I was very sure that, why is this person calling, and I don't even know how to put it off from here. Yeah. So for me, the thing is that the patient had this as the first cause. And that is the most important thing that I felt was to be treated. Now, in these cases, the patient will not get cured with only one remedy, right? The bedriddenness was because of a lot of long-term illness which had caught up with her. which had caught up with her, and then she got into this state. So afterwards, we did treat her for that, and even that did improve. But the most important thing is, after we started treating her with amyl nitrate, it improved. This particular bedriddenness went with the remedy thallium. It's a long case, but then most important for you right now, since it's a thyroid webinar, is the thyroid state. Okay. This is what we gave her. Okay. And this is what started making her move around. But this we gave her much later. First, we had to get her soil ready. She could not move, not with the kind of blood pressure or diabetes or other things that she had. So we first gave her amyl nitrate as the first remedy. Okay. Her, what do you say, mobility improved after we gave her thallium. Okay. She improved a lot. As you can see, the leg pain and the burning and the walking could not be done yet. Okay, but then her boils improved, her what do you say, trembling improved, her palpitations improved, everything improved, but then the other complaints stayed the same. Okay. She still had her neurological complaints, and we treated her for that later. Okay. But everything else that was associated with thyroid improved with amyl nitrate. Yeah, Dr. Amit, I would have given 200 of 1M if I was giving it to a patient who had more susceptibility. This patient was bedridden, and we knew that we had to give something which is very low, because we didn't want to start affecting her in all the other places. Okay, so although we prescribed on the mental state, we gave a very low, what you say, potency, because we were treating the heart, and we are treating the blood pressure, we are treating the diabetes, we are treating the thyroid. And in these such cases, it is better to give a lower dose of and then slowly go higher in it. Okay. Here, of course, we did not go higher in it. We started prescribing her thallium afterwards. Okay. But basically, she improved a lot with um, so breathlessness, palpitation, the eruptions in the scalp, her swelling on her face. See, and these patients, okay. So these patients, you must remember that, like, it's not like us usually in your regular clinic. Now this patient fell in the bathroom one day. So every time you're not going to go with the same prescription and you think that that same thing will work. There will be like a zigzag method of prescription, but then this is how I did it. Now here I gave the patient Zincamet. Okay. But Zincamet was given because afterwards, when we took the history, we noticed that she had taken a lot of medicines for the eruptions that were there in her head. Remember the scalp, the eruptions that we saw? So those eruptions that were there, she had taken a lot of prescriptions for that. And means for me, I thought that that may be the reason she had this, the neurological deficit that we saw, and the weakness in the lower limbs, the burning, the formication, and the paralysis that we noticed in her. Okay, the hemiplegia. So I gave her Zincamet. And of course, as I said, afterwards, I gave her thallium. So this patient is much better now. But for me right now, the most important thing that was a learning case for me in this particular thing is that these small remedies that are there, it is not that we don't prescribe them on the mental state. It is not that we don't see it as a constitutional remedy, but if we look at remedies which are technically constitutional, like natrimur and ignatia and staphysagria and calcarea, but we don't we prescribe only remedies which have got a lot of symptoms or a lot of rubrics to support it, we lose these small remedies which are very effective in the treatment. And these small remedies are what I'm trying to share with you in the Materia Medica. And that's why I wanted to share one, the Materia Medica with you from my perspective or how I see it, so that you know that these are remedies that cover thyroid, okay? And at the same time, you have to also go back. So if you go back to these remedies over here, you have to look at the mentals of it. You have to look for the physical general. So if you're looking at an aurum and an auramide, aurum is chilly, auramide is hot, aurum mur is hot, aurum mur natronicum is hot, that belladonna is chilly. These are remedies that right? You know that this is belladonna is thirsty. The look of belladonna. I'm expecting you to know all this. This is not the place I'm going to teach you what you already know. But I'm trying to give you a peek into how we prescribe these lesser known remedies for more effective cures, okay? And how we don't forget this in our regular day-to-day life prescribing. Am I getting to y'all? So Chetan, one thing that I would like to share with you, since you have mentioned this, I could have done it the other way around too. Okay, I could have decided I'll give Zincamet first. If I wanted to treat, if I wanted the patient to start walking, I'm just giving an example. I would have not given amyl nitrate. Would that be okay? See, this is an interactive thing. Please, please, please share so that we can learn more. When you share with me or when you interact, I will be maybe more active and I will be able to share more. Did that come across your mind? Okay. So again, we'll go back to these remedies just for you to see a little bit of how we are looking at it. So ammonium carb, as I said, I've showed you amyl nitrate, where I showed exophthalmic goiter from grief. Okay. Apis, I've shared with you vascular goiter, but you have to see the apis. You have to see the obese patient with thirstlessness, hot patient, more menstrual complaints, maybe endometriitis. You will see the patient having the irritability of apis, the fruitlessly busy state mentally. Anxiety, palpitations, etc., are pointing to thyroid pathology as surface layer, right? Yes, Nisha, yes, and I'll add to this, because if you know, thyroid has that calcitonin component which causes the palpitations and causes that anxiety and causes atrial fibrillation, right? We know that we have gone through it when we were talking about the pathology of the thyroid, right? Now, when we see a lot of the patients who we have treating for thyroid, and a lot of the remedies you will see right now in thyroid are all also kind of covering anxiety and palpitation. Not all, but the ones that cover this component of the thyroid, they will also have it. They will have it in the mental state also. They'll have it in the physical state also. They will have it maybe in pathology reports also. They might be having heart issues, or they will be having fibrillation, or they'll be having whatever. Okay, but you will find this thing, and you will find it with thyroid pathology. Okay, but it is, how can I say? Now, in this patient, you saw the patient, you can't call this patient very obese or you can't call this patient very thin. Okay, so in cases like this, maybe that was not an important side of the thyroid that was we were looking at. We were looking more at the palpitations and the diabetes and the hypertension. Okay, so every case that you see will have a different part which will be highlighted. Like say, suppose in a patient of calcarea, you'll find the thickness of the skin, you'll find the chilliness of the patient, you'll find the dullness, you'll find the constipation, all looking like thyroid. Okay, but you may not find some other symptoms of the thyroid. Okay. So as I said, all these are remedies that you can look at. They might be covering the pathology. That's why they are kind of pathology specific, but you do see the constitution of that patient in spite of all that in that. Okay, and you will find the constitution also covering the same remedy. But we have not thought of it because we are looking for something maybe which we use more commonly or opposite. We think of Oromos only as a heart remedy, and that's why we don't think of it as a remedy which is good for thyroid. So this particular webinar is for us to see it from both angles and say, oh, this can also be used for thyroid. Or you look at it and say, oh, this is good for thyroid. So let me see if a patient with these kind of mentals and these kind of physical generals come and they have this will also cover thyroid. Okay. Do you all want me to stop here or do you all want me to continue? I can go for one more case or we can do the next case tomorrow. Where am I? Hypothyroidism under pneumocozole 88 mg, but not stopping weight gain. And patient is 12 years having 51 kgs weight, ravenous appetite, lazy, flabby constant, not to calculate up, calculate. Very nice. Thank you, Dr. Chetan. So we will we will go through all the remedies, and after we do all the remedies, I will also be sharing some cases with you, and then you see, because I've given you now I've showed you how you look at the throat, I've showed you how we look at the constitution, whether the patient is obese, up, down, is it a male, is it a female, when is the cause, when did the hypothyroidism get detected, what were the first symptoms of the thyroid that you saw. See, look at it now. I'm really glad you're looking at it the way you're looking at it, but complete the entire history. Okay, you ask me questions after you've given me details of how it started, what happened, when did they start noticing it, what were the symptoms, what was the desires, aversion, thirst, urine, sleep, everything. So take that, past history, family history, was there any injury, was there any other medication that the person had taken, what exactly began it. These are very important, even seeing the miasm of the patient. So what you've given me right now is not enough for me to prescribe. If you see the history I took right now, that history takes us at least 2 hours. We do the whole physical examination. We take it from the point of view of the homeopathic case history taking. We also cover the physical examination as the allopath, and then we prescribe it. Yeah. So I would love to help you in this case, but I will need to have more details. Okay. Let me see. Let's see. Okay. Now, see, please understand, I'm not here to, I'm here only to share with you the results which have come and which have got better, but I'm here to show you an insight into how we study this, okay? This is a case of another housewife. So fasting BSL was 123, slightly high. Creatinine was also slightly high. The uric acid was within range, but usually above 4, I still consider it slightly high. Cholesterol is high, which again, LDL was high. So in these kind of cases, we know that the person might be subclinical thyroid anyways, okay? HbA1c was 6. And the patient came to me for a different complaint. This was all the tests they had done because they were in a lot of distress, and in spite of medication, she was not comfortable, okay? Now, she had taken some allopathic medicine, and after that, she got some swelling. And she had severe chest pain, which and then the doctor had to give her medicine for the chest pain. When I work, I get tired easily, unable to work. Okay, swelling is an issue. Okay, so she has swelling on her face, which is an issue, and she has chest pain, and she's tired easily. She can't work. Till now, what do we think of? We think of a heart remedy, right? Started since a month, started slowly, tiredness, restlessness on waking, swelling since 2 months, mostly on face and hands, cheek and under the eyes, no pain in the finger joints. Below knee, lots of pain, pulling kind of pain, tight feeling. Worse on walking and working. While working, I get tired. I should sit. I can't do continuous work. Lower back pain. Vertigo since a month. Head spins. Exertion. Sister-in-law met with an accident. Mother-in-law was unwell. All work was on me. Lots of exertion. Then she says, thyroid detected 3 months ago. Okay. So before, thyroid was borderline. Body checkup was done. In that, it got detected. Okay. She had migraine issues very long ago, but now she doesn't have. Fungal infection, itching all over the body, menopause 2 years ago. She had heavy menses, but then now she's menopausal since 2 years. Main thing to be addressed is swelling on face and hands, very heavy. Chest also feels heavy. Sometimes abdomen is also heavy. Swelling more in the morning. Tiredness, diabetes, cholesterol, thyroid medication on meds. All these issues started 3 months back. Thyroid, swelling, tiredness, all since 3 months. Heart on waking, pain in the chest, blood pressure since 2 years. Now, understand, these cases are cases which are already taking medicine. They've come to me, they're on antihypertensives, they are on antithyroid medicines, but in spite of all that medicine, they're still having issues. So when I see such cases, first I treat them for what they have, the complaints that they have at that point, and I think of tapering down the antithyroid medicines or the antihypertensives later. That is a later thing. Right now, in spite of taking those medicines, they still have problem. Okay. So migraine, this is her acute of migraine. We do this so that we see what is the remedy that might help during the migraine, and we give this as an SOS in case they need it. Okay. Sinus issues, itching since 15-20 days. I am very depressed these days, crying, very irritated when someone talks to me. I get angry. I don't feel like going anywhere. Just sit at home. Can't walk much. Is short distance. She starts breathing heavily and there's pain in the chest. Stress easily for small things. Things don't get out of my mind. Anything happens to anyone, she will worry. Things on her mind constantly. Swelling more since thyroid detected. Swelling under eyes. Nowadays can't tolerate allopathic medicine, not even painkillers. Doctor has increased the power of the meds. In the morning, complains of unable to open eyes, redness. Doctor said these are the side effects of the medicine she has taken, so she has to reduce them. She started crying when this happened. She saw her creatinine rising. She started stressing. If I consume more medicines, then it will lead to kidney issues. So she started worrying. Then this is her diet, which is reduced. She needs tea. After she started taking thyroid medication, she wants to eat more. And these are her issues. Her family history, her brother has heart issues and psychiatric issues. Her brother has had an open heart surgery and passed away. Mother has hypertension and joint complaints. Thyroid issues in cousins, 4 to 5 of them in the mother's side. Okay, there's blood cancer in the family. So this is the before, during, and after of the menses, but of course she's menopausal now. So hypertension during pregnancy. After delivery, no BP. So hypertension during pregnancy is also thyroid related, okay? Because thyroid increases during pregnancy, and then when the pregnancy is over, the thyroid reduces. This is a physiological increase in the thyroid levels to help in the growth of the baby, okay? So the fact that she had hypertension during all 3 of her pregnancy shows that there was an underlying thyroid issue which was there from the beginning. She always had a weak thyroid, okay? But she didn't have any problem after that, okay? She loves fish, hot food. She gets itching if she has Chinese food. Again, this is a typical thyroid issue where there is a allergic condition that the patient has. So usually allergies is associated to an underlying thyroid, okay? Sweats more on face, burning urination at night sometimes, constipation, acidity, and center of the abdomen touches that epigastrium, burns inside only in the stomach. Hot patient. Sleeping is difficult, thinks a lot, snoring, frightening dreams. So then we asked her, what's happening in the house? Okay, because now we know that this is a recent issue. It's only been 3 months. After that, she started getting this swelling here, there, and the other, which is the main complaint she has. And she also got detected with thyroid at the same time. Okay. So she said her son is getting married and she wants to get a lot of things done, but then she's not healthy, so she's not able to do anything. Why am I getting this swelling? My sister-in-law had such swelling and she passed away with SLE. Okay. And then she said, my husband, he is a very hyper person. So he keeps getting stressed and he shouts, and then I feel very scared. My heart starts beating faster. And when he shouts, I get tension. Then he will become quiet. Since I'm ill, he's quiet, but he has a very hot temper. If things are not against him, he gets very angry very fast. Okay. And then she's always worried. How will he react? What will happen? Then the heart beats faster. She gets disturbed. There's always fear. Then I feel like crying. When he wakes up, I'm scared. What will he demand? What if he does things in front of others? How will guests react? What will people think? People will talk bad about him, how he behaves with mom. He's good in all respects, just his temper is bad. If the food is not good, he reacts instantly. His reaction affects me. It makes me feel very bad. Entire day goes on in head. People who hear will go and discuss with others. All things will go in mind. He comes home late, worries where he goes, what he does, rash driving. I wake up and call him again and again. Okay, and then she tells about her sister-in-law who passed away. So there's a lot, huh? So Here is the thing, crying easily these days over small things in the body when angry, palpitations, no sweating, trembles in anger, cries in anger, crying when, and sometimes bursts out in front of everyone. But mostly at night when I'm alone, I think of things and I cry. Okay. Now these are her vitals. She has dry and warm palm. She has pulse, which has got a good rate, rhythm, and volume. Skin is dry. Face is swollen more around the eyes, shiny swelling with slightly red appearance. 120/80 BP. Thyroid was stony, hard to touch. There were skin tags, which we consider psychosis. Acanthosis, which we see as insulin resistance. Pupils were constricted with right upper flattening in the right eye, which we consider suppressed anger. Bilateral nasal polyps. Okay. The right leg had non-pitting swelling. Now this is her face. Okay. Wow. Yeah, why don't you all suggest nice carcinosin? Anyone else? You'll want to suggest remedies? It'll make it more interesting. No? It's okay if you're wrong, huh? So the remedy I gave was cactus. Okay? Because there was angina pectoris, palpitations of heart, and kidney disorders accompanied by dropsy, which is dependent on cardiac affections, and in exophthalmic goiter. And here I've shared with you the mind, where the patient is melancholic, taciturn, sad, ill-humored, fear of death, of heart disease, wants to be alone, does not want to speak to anyone. Again, they're very slow, cannot talk, cannot do things. Okay. Irritability, worse on constellation, sadness, there's sensitivity to music. And we know cactus, right? What do we know about cactus? Which book do you all want to refer to? Any particular book? Should I go to Kent? The mental state? Yeah. So we see fear and distress because of the intensity of suffering. The patient has never felt such suffering and he does not see what it can all mean. So there's so much suffering, violent suffering, sudden suffering, okay? And struck with fear. Fears death, fear he's going to die. The pain is so intense. Okay, so they're comparing him to aconite. And there is sadness, taciturnity, irresistible inclination to weep, fear of death. Okay, all these along with cardiac symptoms. Yes, yes. Okay, Dr. Chetan, only for you, I will say a little more later. But here, basically, I gave cactus and the patient got much better. So I'll just show you the photo. This is 15 days later. She improved a lot, okay? This was the one thing that was troubling her, and all her other complaints also improved. So the swelling in the abdomen and hands and face went in 5 days. This is her follow-up after 15 days. Migraine better. Okay, no acidity, sleepers better. All these things are better. So basically, the understanding what I want to share with you is that Cactus is also a constitutional remedy, right? We treated her on the anxiety, on the fears, um, on the issues that she had, the sadness, the melancholy, everything. But we did not forget the main thing that she came to us for. She came to us for swelling. She is hypertensive. She's got thyroid. And cactus in has exophthalmic goiter in it. It's got dropsy. It's got palpitation. It's got the, remember the creatinine was slightly raised. Now, what I want to share with you, Dr. Chetan, is yes, carcinosin would have also worked. Carcinosin would have worked, but I'm not sure how much it would have cured. The carcinosin would have worked as an anti-miasmatic. So when we treat cases, I think this is the first time you're joining us. Okay. When we treat cases, there are 3-4 things we keep in mind. One is the miasm that we're treating. And if you see this patient did have, yes, okay, Dr. Chetan, so good. So I'll just repeat this for you. I don't know how many of us are old students and how many are new, but then when we treat cases, we have to see one is that the miasm of the case, which we see in the physical complaints, and we see it in the family history and past history. So she did have one chacha who had cancer. So I will agree to you that there is a cancer miasm in the background, right? And I will also agree with you that she was under constant threat of the fear of the husband getting angry and all that, right? So we did see the carcinosin state come out, right? It is there. It is for sure there. But that is the anti-miasmatic prescription. That prescription would have covered the miasm, and she would have got better to a particular level, and then she would have started getting more symptoms again. And carcinosin would have not got the dropsy down. The patient would feel better. Okay. For the remedy to work on and cure the patient, even according to Dr. Hahnemann or according to Burnett and according to Borick, Farrington, you have to give the anti-miasmatic as well as the constitutional remedy. And if needed, you will give a pathology specific or a drainage remedy also. Okay. But the best remedies are the ones that work on the constitutional level. But what happens with us is when we are looking at a constitutional drug, are we covering these small remedies which are there on the side, which we know little about, but then they don't come up in repetization? And is it because the patient who we're treating on a constitutional level is being given a remedy which covers that sphere of action? Is it because of that that the patient is getting cured? Is one thing we must ask ourselves, because it's very important for the patient to be covered in all the aspects. The physical generals, the physical complaints, the PQRS of the physical complaints, everything has to be covered, right? So we have to be able to cover the ODP, the origin, duration, and progress of the case. We have to cover the cause, the location, sensation, modalities. We have to cover all that also. So here in this particular case, I found Cactus to cover all that. It covered the PQRS symptoms of the case. It covered the cause. It covered the modalities. It covered the sensations that the patient was feeling. It covered the effect of the dropsy, the heart complaints, the kidney complaints, the thyroid, as well as it covered the mentals. And that makes it a more complete prescription. Am I getting to you? So LM potency is something I leave for LM potency is something I leave for patients if I, first of all, depending very much on the drug I'm using. The second thing is I use it when I'm giving it for a more deep acting prescription. Say, suppose I'm giving an anti-miasmatic prescription, I would have given the LM potency. I do give remedies in the LM potency if I want to go on if I want to give that prescription repeatedly for a very long time. Okay, I do use a lot of LM potency. In fact, I think I have a very huge range of LM potency that I use. But again, as I said, I have to feel that I need to use this prescription for a very long time. And if I want to work on a pathological level, then I go for centesimal scale. So here for me, it was important for the patient's swelling to go, because I needed that patient to get confidence in the prescription and the patient to come back. Now, if I want to later on, maybe after 2-3 months, I might start giving the patient cactus in LM potency. If the patient still shows the constitution of cactus, or I might give the patient carcinosin much later, if the patient shows symptoms of carcinosin. I don't give carcinosin unless I see constipation or sleeplessness. If the patient does not have insomnia, I don't give it. So for today, we'll stop here. We'll continue tomorrow. I hope you all learned something today. Is there anything else you all want to ask me? And is there anything you all want me to cover? Welcome, Dr. Chetan. Is there anything else you want me to cover, which you all maybe want to suggest, so that I have one day to prepare if you all want me to cover anything besides the way I'm doing it? Tomorrow also, we will be covering materia medica, and then we will be covering another case. Is there anything else you all want? Dr. Chetan, I highly recommend you to go through my case-taking webinar. It will give you insight into what we do with constitutional prescriptions, miasmatic prescriptions, pathological prescriptions, how we look at the importance of the past history, how do we use it. Now, in this case, I have left all that out. Like, for example, I've given zinc met to that patient. Zinc met also covers the thyroid in cases of suppressed skin eruption. But then I'm not going to show zinc met because zinc met is not here. It is there in past history. Okay, so there are lots of remedies that will be there. Mother tinctures in thyroid, yes. So we know remedies like fucus vesiculosis and all that, which are there for thyroid. So in those cases, I will mention it. Okay, we will be sharing. In fact, I'm teaching you materia medica. So all those mother tinctures will come in. Okay, we do use some mother tinctures in thyroid. We use supplements in thyroid. So I'll be sharing all that with you too. Okay, we'll cover a little bit of goiter. What you say, diet, which is obviously homeopathy related. Ma'am, complete prescription, example, intercurrent, anti-miasmatic, mother tinctures, the indications in detail. Yes. I'll be covering all this. Anti-miasmatic, I will not cover because this is not a webinar for miasms. And I have been covering it multiple times in multiple webinars. So I'm a little skeptical that all people will want to learn miasms again and again from me. If you all still want it, then please message my team, and then I will add a little bit on miasms. Yeah. I need to see numbers for me to share miasms, anti-miasmatics again with you. Anything else? Please let me know if you'll want anything, yeah? Okay. See you tomorrow, same time. Tomorrow I will be on time. Concomitant pathologies with thyroid and remedies. Yes, Dr. Nisha, that is there in every materia medica of mine. I will be sharing with you the concomitant pathologies with thyroid. Thank you.